Hey guys, it's Katie from rnschoolofnursing.com, and it's May. That means it's Skin Cancer Awareness Month. And the reason I'm talking about it today is because basically it's something that you can take an opportunity to educate your patients about in clinicals. And now that the summer's gearing up and the sun is shining, this is something that you can learn a little bit about. In nursing school, I didn't learn a whole lot about dermatology. As far as skin cancer prevention or skin cancer awareness, it's talked about very little when you're in that section in your textbook, but it's not really talked about in depth. So I'll talk to you a little bit about that today, and what better time than May and Skin Cancer Awareness Month. And I'll give you a couple of great resources at the end so you can get more information about the stuff that I'm going to talk about today. So, what's skin cancer? Skin cancer is actually one of the most common forms of cancer in the United States. There are three main types of skin cancers: basal cell carcinomas, squamous cell carcinomas, and malignant melanoma. So the first two, basal cell carcinoma and squamous cell carcinomas, are basically skin cancers that are caused from all the sun exposure that someone has had over their entire lifetime. So it's a cumulative amount of sun exposure. Basal cell carcinomas are the most common form of skin cancer and definitely caused from sun exposure. They don't necessarily have to show up in an area that's always exposed by the sun, like say on someone's nose or chest. They can definitely be located in other areas. Some things to look for when someone has coming in for a spot and they're concerned if it's skin cancer: kind of a pink pearly looking area, a spot that doesn't heal or bleeds on its own, something that's been there for several weeks and it just isn't healing. Those are definitely things to get checked out. A squamous cell carcinoma is the second most common form of skin cancer, and a little bit faster growing than a basal cell carcinoma. And again, that's all from cumulative exposure from the sun over someone's lifetime. And some common areas are the scalp, and areas that it can be very aggressive are mucosal areas, so such as the lips, and those can definitely set down roots and spread and become and metastasize. Now, malignant melanoma is probably one that you've heard about, and that's definitely the scariest one of them all. They definitely come in darker areas, and they can be anywhere on the body. They can even be on the bottom of someone's foot, in between someone's toes, so it's important to educate about skin checks, and I'll talk to you about that in a minute. So the ABCDEs of melanoma prevention goes like this. A is for asymmetry, so is it equal on all sides when you're looking at moles? Is one color or one side darker than the other? B, border. Is the border jagged? Is it spreading like a stain? C, color. Is it much darker than all of your other moles anywhere else on your body? D is for diameter. And generally we mean if it's larger than a pencil eraser, so 6 millimeters in diameter. If it's larger than that, something you should get checked out. And E is actually a new one, and E stands for evolving. And that's when you really count on a patient or someone who's been doing self-skin checks, and they check to see if it's changed at all. So if it's something that you're seeing for the first time, it's hard for you to know if it's been changing, so you really count on them hoping that they've been monitoring it if it's something that's questionable. Sorry about that, the card filled up, so I had to restart. But next I want to talk about skin cancer prevention. Prevention is huge. This is your opportunity to educate. And really, no matter what situation, clinical situation you're in, there's really always an opportunity to educate patients. And it's great to bring stuff like this up because it's Skin Cancer Awareness Month. So first thing is stay out of direct sunlight, seek shade. Being in sun, direct sun for long periods of time, even with sunscreen, you're still going to get UV exposure. So it's really important to try to just stay in the shade as much as possible if you know you're going to be outside for long periods of time. Second, wear a big, wide brim hat. Very important. Those baseball caps are just not good enough. A lot of the guys like to wear those, and a lot of times we see skin cancers on the ears, backs of the neck, and even the little holes through the caps. You can get UV exposure through there too. So a big wide brim hat, usually a couple inches, that's going to come out. So it's going to protect this whole area, your whole face, your shoulders, your neck, your ears. Definitely wearing sunscreen. 30 SPF or higher is what's recommended. Anything lower than 30 is just not going to be good enough. And believe it or not, you can put sunscreen on wrong. There's physical blockers and there's chemical blockers. I won't get into too much detail about it. I'll put more information in the blog post, in the article that I'm going to post. But basically, physical blockers are the best. They're physically blocking the sun. Chemical blockers have to be applied a couple, minutes, or actually 30 to 60 minutes before being out in the sun. And they activate when the sun hits it. So it's not really doing anything until you're out in the sun, and then the chemicals in the sunscreen are what's blocking the sun's rays. So make sure you put that on in enough time, and you're reapplying. That is key, and making sure that you're using 30 SPF or higher. Broad spectrum types of sunscreens are very important, so you'll see on the labels UVA and UVB protection, so it's getting both of those, which is a broad spectrum, so that's important to teach patients as well. Examining your skin. So teaching self-skin checks is pretty easy. You can just tell them that it's good to check your skin at least once a month, and just kind of doing a quick once-over in the shower is a good time to do it since the clothes are off anyways, and making sure that you tell them to check between their toes and under or on the bottoms of their feet and between the fingers, places that aren't usually seen every day just by doing normal daily activities. So encouraging them to pick a day of the month to do that and to check for any changes of moles, any new moles, anything that's out of the ordinary that they can bring up to their primary care physician is very important. So I will be posting an article here in the next day or two, so please check that out. I will have lots of information, more about skin cancers, sun protection, and I'll also have some great resources on there that you can write down and check out for yourself if you're needing to get more information from some websites. And that's it today. So I hope you guys have a great day, and we'll see you next time at rnschoolofnursing.com.